All right, everybody. Well, we're finally ready to do the treatment. We've worked through our pre-treatment examination. We've checked the patient's ocular surface. We've stained them. We've cleaned off the stain. We've done inflammatory or osmolarity testing or both. We've done a speed questionnaire. We've Fitzpatricked the patient's skin. And we're finally ready to turn the device on. I know when I first got the device, I was a little intimidated by all the options and various buttons and things, that the device has on it. And it's really become very easy for me to navigate with just a little bit of practice. And I want to let you know I'm always here also to help you navigate any questions you may have in turning it on and finding the right settings. So very simple. To turn it on, you want to go ahead and press the green button. So we're going to go ahead and press the green button, fire her up. Now, the device is kind of loud. Not a bad thing. It's cooling. It's doing lots of things. And so it's cooling the sapphire crystal tip. It's firing up the energy to go ahead and provide the treatment. But it's a loud treatment. And so, what I'll tell you is sometimes it's a little bit intimidating if you leave a patient in a room with the device. For one reason, one, it's a little bit loud, and two, it provides a good amount of heat, even as it's sitting there. So if you leave a room and you close the door and you don't get back in there for another 15 or 20 minutes, I know we sometimes run behind, that could really cause the patient to be warm and also maybe a little intimidated by the sound of the device. So my advice would be have the treatment room separate from where the patient is prior to treatment. Get them in there when the treatment is ready to be done. And also, it's going to take a few seconds for the device to boot up. There's going to be a password that you'll go ahead and plug in. We made ours really easy. It's 1, 2, 3, 4. Don't tell anybody. I'm just kidding. So for some of you, you will have various devices attached to your M22. There are, of course, different applications for this very powerful module, like the Resurfix or ND-YAG laser. We are not talking about lasers today. We're talking about the IPL, or Intense Pulse Light Lumenis M22 OPT treatment. So we're going to go ahead and press the IPL. If you do not have those other options on your device, if you don't have them actually plugged in, that won't even light up as an option. So you just press the IPL, and then it's just going to run through some self-tests. And as it does that, it then turns on. So the first thing we're going to see when it turns on is that you're on the IPL, or Intense Pulse Light application, in the left-hand side. That tells you you're in the right place. In the lower left-hand side, you're going to see your pulse counter. Your pulse counter is going to be important when you actually do your treatment. It should be in this little box at the bottom, zeroed out at 0. If it's not, you could click it and it'll zero it out. The number that's there below those big zeros, here it says 19,000, is the number of pulses you've done the lifetime of this device. There is a certain number of pulses that you should know will be important to do some general maintenance on your device that your rep will go over with you. The next thing we're going to talk about is this little button right here. That little button right there is going to be the first thing you press. So right there where it says VL. So here we have our select application. This is sort of the broad category of where we want to go. So we have vascular lesions, skin treatments, or pigmented lesions, or even hair removal. And so these are really where IPL shine. IPL is, or Intense Pulse Light, is absorbed by oxyhemoglobin in blood, so vascular lesions. It's something that treats the skin, and in the skin we have pigment in blood, so skin treatments. It's a little bit of a more mild version of the vascular treatment. Pigmented lesions is going to focus a little bit more on the pigmented lesions that we might have in our skin, like sunspots. And hair removal, of course, is for hair removal. Okay, so those are the treatments that we're going to have options to take part in. Skin treatment is going to be the area, or vascular lesions, that we're going to pretty much focus on. So let's hit vascular lesions first and see what's there. So we hit vascular lesions. Now we're in the right setting, and we'll X out of this box. And we're going to go up to the stethoscope. And the stethoscope is going to bring us to where we're able to actually pick the type of treatment we want to do. At the top of each one of these screens is going to be the Fitzpatrick scale. Again, the Fitzpatrick scale is going to allow you to determine what kind of treatment is going to be safe for the patient based on how their skin reacts with light. So let's say we have a Fitzpatrick type 3, which is going to be very common, 3 and 4. And so we have a patient that's Fitzpatrick type 3. We're going to use our square light guide. You might say, well, what is that? Well, the light guides are held in your little secret cubby hole here. And you're going to get with your device a rectangle light guide, a large rectangle foot guide, and a small rectangle foot guide. Now that small one is going to be better for treating the lids, and it's going to provide a treatment that is going to go a little bit more apical in the skin and more concentrated. It's not going to spread out the treatment, where this one is going to spread out the treatment. It's going to go a little deeper. This is what we're going to use for our full face treatment in Toyo's protocol, and this is what we're going to use for our eyelid treatment. Both of them are square treatments. And so the light guide here is going to be always square if you're using one of those two. In the vascular lesion section, basically the only thing that you're going to be using is the facial telangiectasia option. Okay? Now, if we press facial telangiectasia, we're going to use the shallow. We always use shallow. It's going to give us a couple options. It's going to tell us to use the 560 nanometer wavelength or the vascular filter. If you have the vascular filter, that may be something you choose to use. The vascular filter is a filter that filters light at a more apical point in the skin and a deeper point in the skin to hit the two different areas where vascular lesions are in the apical part of the dermis and the deeper part of the dermis. That's going to be the vascular filter. It's often a stronger treatment, a little bit more sensitive to the patient, and this is something that's going to be reserved for really stubborn telangiectasias on the face and really more spot treatments, probably not associated so much with dry eye. The other treatment here that you see, the 560 nanometer, that's going to be more apical. So this is the vascular lesion page. Really the only one that we're going to be concerned with here is going to be the facial telangiectasia option. Okay, that will bring us out to actually do the treatment. I'm not going to go through that right now. I'll show you that when we actually do the treatment. Let's press on this again and go back to our umbrella choices and pick skin treatments, because skin treatments are going to be the thing that you use most often. So let's go ahead and press our stethoscope, see what options we have. So again, we have the skin types by Fitzpatrick score. We're going to pick a 4 this time. Darker skin complexion, maybe somebody who's of Italian descent, who tans easily and doesn't burn often. We're going to have the rectangle light guide. Again, either one of these light guides are going to be the square choice here. And then we're going to pick an option. The two ones that I use the most are rosacea telangiectasia, and I use that more for really visible, dilated telangiectatic blood vessels on the cheeks and other places on the face and eyelids. And erythema of rosacea, which is one I use the most, and that's going to be for generalized redness on the cheeks and lids. So let's say we pick that one. That one's going to be most common and a little bit more of a mild treatment. We're going to use the shallow lesion depth. That's what the one we're going to use every time. Shallow lesion depth, and it's going to tell us what level our treatment is going to be at. So we're going to go ahead and press OK. And it's going to ask us, in order to use this preset, please change the filter to 590 nanometers. Okay. So we're going to go ahead and get our device, get our light guide. We can see we don't have a filter in here. We're going to go ahead and get the correct filter, 590, and we're going to place it in the device. There we go. So we placed it in the device. Now we're going to get the correct crystal. So we pull this lever up, and that releases the tension, and it allows you to then go ahead and place that light guide into the handpiece. We're then going to close this to increase tension and hold the sapphire crystal in place. We now have the 590 filter and the larger crystal in place. We're going to look back up at our screen and review everything real quick to make sure we're in the right place, doing the right treatment. So we have a skin type 4. We're using the skin treatment, erythema of rosacea in the shallow setting. We should have the 590 filter on. 15 is correct. 10 is the lowest possible setting. So if the machine thinks that you're not doing the right thing, it goes to the lowest possible setting. So there we have it. Now what you see here is actually the way the treatment is delivered. And so what we'll see here is that we have a 5 millisecond pulse of 15 fluence energy, a 30-second thermal relaxation time where the skin has time to relax, and then another 5 seconds of energy pulse. So that's a double pulse of 15 fluents with 30 milliseconds in between. Now I want to show you what it would be like if we picked a skin type 3, not 4. So again, 15 with 30 seconds in between. So let's go ahead and pick a type 3. So let's pick a type 3, rectangle, erythema of rosacea, shallow. All right, so press OK. It says, oh, wait a second, we want you to change the filter. Not a 590, a 560. Okay, so I'm going to go ahead and take the 590 out. Put the 560 in. Again, this is going to have to do with the way that the skin reacts to light, so it's changing the depth that the energy is going to be placed at. We're going to press OK. And now what we have is something that looks a little different. We have 15, which is a little bit different. The energy, the fluence is going to be a little bit different. We can see that the delivery of the energy is going to be a little different also. Here we have 5 millisecond treatment, and instead of 30 milliseconds of relaxation time or cooling time, it's only 20, followed by another 5 millisecond treatment. So this is going to be our erythema of rosacea treatment. The only thing that we need to do now is go ahead and deliver the treatment. So another really common treatment that you're going to do, probably the most common treatment that you're going to do, and maybe for some of you the only treatment you're going to do, is going to be the pre-programmed MGD, or meibomian gland disease treatment settings. These meibomian gland disease treatment settings are going to come pre-programmed on your Lumenis M22 IPL. And so you're going to find that by going to the stethoscope on your device, press the stethoscope. Instead of by clinical, where you input each piece of information to tailor the treatment to the patient, you're going to click by name, and you're going to see that pre-programmed MGD setting by Fitzpatrick scale already pre-programmed in your device. And so we have a Fitzpatrick 3, let's say. So we're going to pick MGD Fitz 3 here on the screen. Click. And we're going to go ahead and press OK. It says, hold on, do you have the right filter in place? Well, this says we need a 590. I have a 560. So we're going to go ahead and take out the 560 and put in the 590. Real easy. We're going to press OK, and it's going to give us the correct treatment. So you can see where in the erythema of rosacea treatment, we had a couple things different. We had a double pulse, now we have a triple pulse. We also had 15 fluents for that patient, now we have 12. So by and large, the MGD treatments go a little deeper into the skin, and they also are a little more mild in fluence or power. The other thing is that instead of being a double pulse, they're a triple pulse. And in that triple pulse, you'll see that the thermal relaxation time is much larger, which provides for a safer, more calm treatment. So here, instead of having 20 or 30 seconds of thermal relaxation time, we have 50 milliseconds of thermal relaxation time in between each pulse of treatment. So with each pulse of treatment, we get a 5 millisecond pulse of light, 50 millisecond break, 5 pulse of light, 50 millisecond break, 5 pulse of light with a lower energy. So this is what we're going to do. We're going to do tragus to tragus with some form of eye covering or protection. You have a couple different options as far as that's concerned. You can use the eye protection that is going over the eye, a little IPL sticker that places over the eye. This is going to be your easiest way to treat. Now, many of the studies that were done for IPL were tragus to tragus, Toyo's protocol, with this very protective covering over the eye. More recently, you may have heard about laser grade shields. Laser grade shields are very accessible, easy to get, easy to clean, and safe to use. There's been several studies now that show and display their safety and efficacy. I prefer to use the laser grade shields, but every now and again I use the stickers. So what we'll do is we'll go ahead and place those on. We'll place ultrasound jelly on the eye. We'll do the treatment. Now, if we are using the laser grade shields, we're going to do the lids. To do the lids, it's very difficult to place this crystal on the eyelid. So, in which case, this is when we're going to actually use that one. So we're going to go ahead and open that little lever, get this out. This can sometimes be a little stubborn, so sometimes it's better to use a tissue to do that. We're going to get that one, and we're going to go ahead and place that right into the device and close the handle, just like that. Then we're going to go ahead and do our treatment. So now I'm going to show you how it is to do a treatment with both the stickers or the IPL shields over the eye and also the laser grade shields on the globe itself.